Hi guys, welcome back to another Periscope with me. I am so excited as always to be presenting to you all. Thank you for tuning in. Please feel free to share this with your followers or to invite them in, as well as to give out hearts. I love hearts, especially green hearts. Go green. Today we are going to do a two subject Periscope. I believe it'll be pretty short. I know normally I don't do really long scopes anyway, but today will be a little bit shorter than usual. Before we get started, my name is Mia. I am a certified personal trainer, fitness blogger, and newly published author. Super excited about that. As well as owner of CCB Fitness here in Chicago, where we are aiding people to a healthier lifestyle via weight loss, muscle toning, muscle sculpting, and nutrition. I have several different social media pages, and I would love for you guys to follow me on those different pages. The content is always different as well as the presentation. All right, so you can check me out on Facebook and YouTube at capital CCB space fitness. You can also check me out on Instagram at CCB_fitness. All right, and of course, as any other business, we do have a blog and a website. It is at www.ccbfitness.weebly.com. Again, that is www.ccbfitness.weebly.com. If you're just joining in, feel free to give a little heart, tap the screen at the bottom, or to share this with your followers. So, part one of today's Periscope is, what do you want to know? Seriously, what do you want to know? Tonight, I will be interviewing 2 to 3 women who have graciously allowed me to pretty much probe into their privacy as far as their experiences with mammograms are concerned. The reason they are allowing me to interview them is they want to help me empower women. Unfortunately, every woman doesn't have a mom or a sister or even an older friend who they can talk to for these different situations. What I'm looking to do with this interview, or with these interviews, as there are more than one, is to debunk some of the myths and to help to curb some of the fear that comes along with mammograms. I know there are a lot of women out there who are very close to the age of receiving that first mammogram, and they're scared. They don't know what to expect. I'm hoping to help them and you, if you're watching this, to just ease your fears on mammograms, okay? Getting the mammogram is such an important part of being a woman. It helps to promote your health. It helps to prevent other diseases and other illnesses. Of course, number one, breast cancer. So it is extremely important that we conquer this fear together. And the best prevention, or the best treatment for breast cancer, is of course prevention. But one of those ways and one of the mechanisms that we use in order to help prevent, it's a mammogram, guys. So mammograms, they're done annually once you reach the age of 40. It used to be 35, but the guidelines have changed, so it's now 40. If you have a history of breast cancer in your family, you actually still can begin receiving your mammograms at the age of 35, but it is an annual process. All right, again, there are plenty of women out there who are super close to that age range, and the first mammogram is creeping up, and you have those feelings that are just like, oh my god, I don't know what to expect. You're nervous, things of that nature. This Periscope and the interviews that I'll be doing tonight are to help you. So feel free to let me know what questions you'd like for me to ask these women. I'll be blogging about the interviews and answering all of the questions this coming Saturday. So I won't leave you out in the dark with your questions or your answers. You send me the question, I'll definitely give you the answer. So you can tune into the blog this Saturday to find those answers, and more than likely I'll do a scope next week regarding those interviews as well, okay? Now, in order to send your questions, you can email me at ccbfitness1@gmail.com. Or you can actually DM me or inbox me via Facebook or Instagram if you're on one of those methods or one of those modes of social media. So now that we have that out of the way, The second thing we are going to discuss today is how to do a self-breast exam. All right? So, self-breast exams are the first measure of prevention. And these guys should be done monthly. So these are not annually, these are done monthly. Generally, women should do them after their monthly, and it should be done around the same time every month. So if you know that your monthly is usually at the beginning of the month, probably the second week of the month, you're going to want to go ahead and do your self-breast exam, all right? So a few different tools are needed before you actually partake in the self-breast exam. You're going to need a pen and a notebook. I say a notebook because you want to keep consistent notes and you want to make sure that they're concise and you can actually find them when you need to. So that's why I say a notebook, not a sheet of paper, okay? You want to keep all of that pertinent information together. But you're going to need a pen. You're going to need a notebook. You're also going to need really good lighting. So the room I'm in right now, perfect lighting. However, no mirror, so it wouldn't help. A mirror is the next thing you're going to need, all right? Now, what you do once you get into your room with your good lighting, you have your pen, your notebook, you can also actually have your phone. With the recent advances in technology, people like to, or some people, not all, will actually take a monthly picture of their breast. Why? Because that allows them to see if there were any changes from month to month. They aren't to send out to sext or to text anybody, but it's just for their own documentation so they can see from month to month what those changes of the breast were, all right? All right. So that is step one. Grab all of the necessities you need. Again, those necessities are a journal or notebook, an ink pen, good lighting, a mirror, a room with a mirror, and perhaps your cell phone if you'd like to take pictures of your breast to compare them with. The second step is going to be to stand in front of that mirror with your shoulders nice and squared, so nice and even, and your hands on your hips. Once you have that position assumed, you're going to look in the mirror, and this is when you start looking for different signs of discoloration, discharge. You want to look to make sure that the position of your nipple hasn't changed, to make sure that there are no sores or patches, no red marks, so no discoloration, things of that nature on the breast, okay? You want to make sure that one is not gigantically bigger than the other, so we're looking for symmetry, and we're looking for any other signs of irregularities, all right? So if you happen to see any signs of regularity, it is important that you document the day, the time, which side the irregularity was on, and what you saw. For example, if you happen to see a little bit of discharge from your right breast, you would document that as Thursday, October 20th, 2016. The time I'll say is about 2:05 p.m. And you would write discharge. You would write what color, what texture. Was it thick? So was it milky? Was it pussy? Or was it thin like breast milk? Okay. What type of texture it was. What color. Was it white? Was it yellow? Was it off-white? You're going to write all those things down in your journal, all right? That is step one. After you complete your notations, you can go ahead and decide whether or not you want to do your self-breast exam in the shower or whether or not you want to do it laying down. Now, there are no differences between doing the self-breast exam in the shower and laying down. It's simply a matter of comfort. Some women are more comfortable doing the self-breast exam in the shower because the water, one, of course, is going to relax the muscles, is going to relax the skin, and you can feel or palpate things a little bit better in water and in heat. And others just like to be comfortable laying down. Either way, it does not matter. There are no pros and cons to either way. It's simply up to you and your comfort level. So that's going to be step 3. Decide what you're most comfortable with. Self-breast exam in your bed, laying down, or self-breast exam in your shower. Whichever method you choose, the steps that are afterward stay the same, and that is the most important, right? So, the first thing you're going to do when you're giving or administering your self-breast exam, you actually want to put your hand behind your head for whichever breast you're starting. Why is that important? Because you want to start in the armpit. And the reason you want to start in the armpit when you're doing your self-breast exam is because the lymph nodes from the breast connect to the armpit. So in the event that there is some type of lump or cancer or something of that nature, you want to check and make sure your lymph nodes have not been affected, okay? So always, always, always start in your armpit. Now, there are 3 different methods or techniques you can actually utilize when you're administering your self-breast exam. So, I'll demonstrate on my armpit. You can either go in what are called spokes. So think of a bicycle kind of out and around, so to speak. That would be a spoke. You can go in the circular motion or in the, I like to call it zigzags. It's kind of easy. You just simply take your fingers and you're making loops really. So you're going down and up. Pretty big loops, okay? Or you can go in this manner, vertically, okay? So those are the different manners in which you can actually administer your self-breast exam. Now, once you finish with your underarm, of course, you want to start moving down into the actual tissue of the breast. You want to make sure that you maintain your same 2 to 3 fingers that you are touching or palpating with. When you use those fingers, you want to use the actual pads of your fingers. So you want to use your fingertips. You don't want to use the bony area. You want to use the pads, the tips. Why? They're more sensitive. They have more of those fibers and nerves that you're going to feel with. So that's why you want to use that part. You do not want to venture down into the actual bone and fingers, okay? Use your fingertips and continue to use your same touching technique. So if you started with the spokes, you want to continue with the spokes. If you started with the zigzags, you want to continue with your zigzags. If you started with vertical, you want to continue with your vertical. You do not want to change between the 3 or interchange the 3 during one self-breast exam, all right? Now, if you find that one method is more comfortable than the other, fine. The next month, you can change over. But for the sake of consistency and of making sure that you aren't scaring yourself and that you're doing your breast exam efficiently, you want to make sure that you stick with the same method for that particular 5 to 10 minutes that you'll be palpating your breast, all right? So after you go through each part, so your underarm, your breast, make sure that if you feel anything, you take those finger pads and you attempt to move the actual nodule or fiber, all right? You want to document where you found it, if you could move it, if you felt any pain with it. All of this is extremely important. And then, before you freak out, you want to go to the next breast and do the exact same thing, okay? So, once you're done with your self-breast exam, the cool thing about having that journal is you can go back for however long you want to go through and view the history and see what changed or what may not have changed. If you found a lump, you can actually go ahead and call your physician. Now, remember, most of our lumps are not cancerous. Most of them are actually fibrous. Some of them are even cysts, okay? So if it's a cyst, nothing to freak out about. If it's fibrous, nothing to freak out about as well. You can find out the difference between the cyst and the fibrous lumps in last week's Periscope, which is on YouTube, or you can check my blog at ccbfitness.com. But I'm not going to go too far into depth with that today. Also, and I didn't notate this or say this at the beginning, but if there are no changes in the breast, you don't see any irregularities, I would also still document that. So if you do your self-breast exam today, you would just write today's time, today's date, and just put that both breasts look normal. There were no changes in the breast. That is also very important to document. So you want to document whether or not you see changes, okay, guys? So let's do a very quick reiteration before I let you go. The tools that you're going to need for your self-breast exam: ink pen, journal or notepad, good lighting, mirror, and perhaps your cell phone. After you stand in the mirror and make sure your shoulders are nice and square with your hands on your hips, you're going to observe and look for any differentiation, any discoloration, any patches, any redness, any discharge, any displacement of the nipples